Whenever you talk about colonoscopies, a lot of people talk about how much they hate it. My sister-in-law always responds with, that's a piece of cake compared to surgery, radiation, and several rounds of chemo. I'm happy to say she's a survivor. Because of colonoscopies, thousands of people never get colon cancer in the first place. Joining us with prevention and treatment, welcome Dr. Joseph Cali with UT Physicians, along with his patient, Robert Boudreau. Good morning.
Thank you.
All right, this is one of those cancers that we have some control of.
Correct. We screen people now because it's such a common cancer, and the precursor is the polyp, and we remove the polyp. And that cuts down our chance of getting colon cancer 80%.
Wow, okay, so the thing is we have to go in. Robert, you're one of those people who's always taking care of everybody else.
Yes, I have.
In fact, we have a nickname for you, Santa Claus.
Yes, I've done Santa Claus for 18 years.
There you are with Dr. Cali, right?
Yeah, just charities and stuff. I don't take it. I do it for fun. Shriners hospitals and nursing homes and stuff like that. Masons Halls.
Yeah.
And I never took care of myself very much.
Yeah. What was the thing that finally brought you in?
My daughter's a paramedic in Florida, and I was 17 years late. I ignored it for 17 years. Stupid male pride, I wasn't going to have that done. And she finally broke down and cried, and one of her friends died of colon cancer. And she broke down and cried, and I said, okay, I'll try it.
Yeah.
And I was scared to death going in. But I went in the operating room, and they put an IV in me, and I'm joking, I told jokes. I was joking away with Dr. Cali and the nurses and everything, and I don't even remember getting tired. Next thing I know, I'm waking up in recovery, wondering why they didn't do it, because I didn't feel any different.
Right. All right, so the process is something that we don't have to worry about anything there. But the thing is, when he finally went in, you found there were some issues.
So when we did his colonoscopy, and we actually thought the problem was we thought there were hemorrhoids. That was the problem.
Right.
And we found a lot of polyps, and we took a lot of polyps out, and one of the polyps had colon cancer in it.
Wow. Okay. So what are the symptoms? Because I know sometimes people might not even have any symptoms for a while until it's really advanced, right?
Right. So the symptoms can be bleeding, it can be pain, it can be change in bowel function. But the whole goal for screening is actually to get there before the symptoms occur.
Yeah, and again, this is one of those things that is one of the most deadly cancers, not because of not going in and getting the colonoscopy, but because people don't.
Correct. Lots of people attribute it to other causes like hemorrhoids, the bleeding or change in bowel function. So if we get in there early and get the precursor out, or if we find the colon cancer early, people have a normal life afterwards.
Yeah, all right. Who's at risk? And I guess you could almost say anybody at a certain
So
degree.
if you have a colon, you're at risk.
Yeah, right. Yeah. And the thing is, I mentioned earlier how we're outgrowing our teeth, we're outgrowing our ears, we're outgrowing our hips and our knees, we're also outgrowing our colon. So things are likely to happen at times.
We are. So if you were to look at everybody in the United States that gets colorectal cancer, 70% are sporadic, not hereditary. That isn't to say that there aren't high-risk groups, people that have family histories of colon cancer, people that have inflammatory bowel disease, ulcerative colitis, Crohn's disease. Those are higher risk groups, but otherwise everybody's at risk for colorectal cancer.
And I'm glad you said that, because a lot of people will look for, it doesn't run in my family, and think that that's okay. Well, it didn't run in our family either. For my sister-in-law, it didn't run in her family either. And then she had an advanced case of colorectal cancer. Okay, when should we get our colonoscopy?
So currently the American Cancer Society is recommending screening for everybody that's an average risk individual at 45. What's scary is that we're seeing higher rates of colorectal cancer in people in their 30s and 40s.
Wow.
So
Do we know why?
Well, we don't really know why.
Yeah. Lifestyle, possibly?
It's most likely lifestyle. I don't want to peg it on one thing because we're not 100% sure, but we're seeing a doubling in the rate of between 30 and 40 and 40 to 50. So we're rethinking screening for that age category right now. But certainly if you have any symptoms, you need to go in and get it investigated.
Yeah, and I got to tell you, I had a colonoscopy, and it was the easy. Now the prep is one thing, right? But you go through that. But it was the easiest thing. I don't even remember any of it. To your point, you kind of, I think the doctor said, say hello to your best dream. And the very next thing he says, you're good for 10 years. So I'm glad to know that I'm good for 10 years, but glad to know when they found something with you and my sister-in-law, that's the reason why you're alive today, by not putting it off. What do you have to say to somebody who knows something might be up, don't know quite yet what, but they're too afraid to go in?
I held off for 17 years, and it was easy. I'd rather I'd be more scared of a filling. Your dentist goes on. It was nothing.
I've had a filling with her. They're easy too.
And I had no symptoms. I had a little bit of bleeding, but like you said,
Yeah.
I have hemorrhoids.
Yeah.
So, or had hemorrhoids, and it was very minor.
Yeah. He said he held off for 17 years. Other people would not have 17 years to work with.
Correct. Lots of people that hold off can present with advanced colorectal cancer. So that's why we want to catch it early.
Yeah, because the further along you are, the tougher it is
Right.
to.
If it's a more advanced colorectal cancer, then you may have to undergo radiation chemotherapy
Yeah, all right. And you are.
and surgery.
Yeah, because you remove what, 10 inches?
Yes.
Yeah. All right. And
Just
how-
the right amount.
Yeah. How are you feeling today?
I am feeling great. It was, the colonoscopy was a breeze, and now with the advancements in the robotics, he uses the robot arms to do it. I got out of surgery when they did it at 5:30, and at 8 o'clock the next morning, I got out of bed, and I didn't get back in bed until 11 o'clock at night.
Yeah. All right. Now you've convinced some of your other friends to do the same thing.
Yes, I've been going on a little mini rampage. Don't die. When you talk about it, you find that a lot of people, almost everybody, knows somebody who's died from colon cancer.
Right.
And it's not a man's disease. Everybody thinks it's a man's disease because of breast cancer trumps it so much they don't realize women get it just as much as men.
Absolutely. Like you said, if you've got a colon, well, you have a chance of getting the cancer, but you don't have to. For more information and to book an appointment with UT Physicians, you can call 888-4UT-DOCS, 888-488-3627, or visit utphysicians.com.